We're continuing our talk with David Ashford, the Minister for Health and Social Care. We've got many questions coming in during the week, and if you want to send one in, please, it's news@manx.net. I'm trying to keep across Twitter and also the Facebook pages, but we'll continue with questions here. I'm surprised that given the amount of individuals testing positive on day 13, 14, that a further test on day 21 is not being done to ensure that individuals are negative. Are they certain that the Kent variant does not have a longer life than other variants? Are they certain the risk is actually low enough to assume that after 21 days, the positive cases are still not shedding?
Yes, the science does not show around the Kent variant that it has a longer incubation period. In fact, interestingly, quite a few bits of the science actually show the opposite, that perhaps it actually has a shorter period than the original. That's still early days as well, but one of the things that seems to be emerging with the Kent variant is that people develop and show symptoms earlier than they did with the previous version. So whereas with the previous version you were looking around about day 5, day 6, the Kent variant, some of the papers I've read seem to be shown around about day 3. We are very confident, or as confident as we ever can be, because the science constantly changes, but certainly the science at the moment does not point to the Kent variant showing that it has any greater incubation period than originally. And like I say, there's some very low level evidence that perhaps it's even actually shorter.
Okay, and maybe following on from that one, it says, I've heard a couple of cases that contact tracing are only going back a couple of days now for the positive cases. How can this be the case when we know that Dr. Henrietta explained the incubation period can range up to 14 days? We're only a week into lockdown, so still seeing cases from pre-lockdown coming out. So surely contact tracing should be going back 14 days when the island was still as normal.
So this is pretty much the same as the question you just asked before. So it's exactly the same answer in that it depends upon the case how far contact tracing will go back. In some cases, if people are doing as they should be, particularly in a lockdown, they will only need to go back about 48 hours. In other cases, they will go back 7 days or basically more. Just on that with the Kent variant as well and the 21 days, we've got to remember that a day 13 test, people will remain isolated, but it may well be that they're not infectious anymore. They're just still shedding the virus, because we've had cases of that in the past as well, which you might remember, Paul, from the outbreak last year, where I think it was about 5 cases of that we had, where we had what we had termed persistent long-term shedders who might not necessarily be infected but are still shedding the virus, so will show up positive on a PCR test. But that's why the day 13 test is there, and if anyone tests positive, then it's 21 days.
This next one might have changed now we've got the dashboard up and running, but on Monday at the end of the day, the COVID, this says dashboard stated there was 180 awaiting tests and 1 awaiting results. But when they came out on Tuesday, it stated there were 87 new cases. So the question is, where did they come from? As on Monday, the dashboard was updated, and at the end of the day, that's what it said.
Yeah, but let's not forget again that with the dashboard, it is still a point-in-time snapshot. So it's a snapshot taken once a day at 3 p.m. Things carry on past 3 p.m. So 111 is still getting calls. They're still booking in tests. There are still tests being processed by the lab. So it's the same as, when I do the briefing at 4, my figures at 4 o'clock are never going to come as a surprise to you now, Paul, because everyone will be able to see them at 3 from the dashboard. But it's exactly the same situation. It's that snapshot at that point of time. And as the day progresses, things will carry on. So tests will continue to get booked. People will continue to ring 111, and the lab will get further tests sent up to them, because the awaiting results purely in terms of the lab is of the tests they have received. And of course, each time they do a test at the grandstand, it doesn't immediately go up to the lab. They go up in batches.
I'm a returning resident undergoing the 14-day 3-test routine. My second test has come back negative, and they should issue me now with a new direction notice allowing me out for an hour's exercise a day. Despite multiple emails and a 40-minute wait to talk to 111 and following a check of my email address, I still have not received a new direction notice. I thought after each day you received a new notification. I thought after each test you received a new notification. Do I presume I just leave it until midday on the 14th after a negative result and await a new direction notice which previously hasn't arrived?
In relation to the direction notices, my understanding within the regulations, there's actually provision that if you have 2 negative tests, then you can exit for your hours exercise. That's actually within the regulations. I'm not sure of the actual paperwork side in 111 whether they do issue a new direction notice or not, but certainly within the regulations, if you've had 2 negative tests, that does allow you to have the hours exercise, assuming you socially distance from anyone who's not in your household and you use appropriate PPE.
This person says, you said cancer screening wouldn't be affected. Someone close to this person has been referred for an urgent mammogram over a week ago and has been told that she won't get it until at least April. That's over 6 weeks when it's supposed to be done in 2.
This, unfortunately, isn't down to COVID. There has been issues which we've discussed in the media before, where we've been looking to get additional resource in. The cancer screening programme is running as normal, but there has been exceptionally long waits, and that's not to do with COVID. That's actually to do with the backlog of patients, an increase in demand on the service, and also staffing for the service. So as much as I would like to be able to sit here and say that's down to the COVID outbreak we've had, unfortunately it's not. We have been looking to additionally resource up the section. There has been additional clinics put in too, but there is still a wait for urgent wait times. And that's exactly the same in the UK as well with their services.
A question about PPE not being used in the prison, and should this be the case that they should be having PPE?
Well, I don't know what they mean by not used, but certainly under circumstances there should be appropriate PPE in use. And if people have concerns around that, then I would urge them to raise it with the Department for Home Affairs.
My sister's terminally ill and has been asked for the vaccine. She was told by one nurse she couldn't have it, but by another she did after being persistent. So this is the AstraZeneca one, although it probably doesn't matter. Mixed messages, or is that just a complication that's just happened?
It would be a medical decision, because some people with certain medical conditions can't have the vaccine, and there's medical reasons why. So if the person is seriously ill, or in this case, as it sounds, rather tragically terminally ill, then that would be a medical judgment. And it sounds like there was a disagreement between 2 medical practitioners as to whether it was appropriate for them to have the vaccine or not.
I've been told that 3 staff working at a certain takeaway restaurant had tested positive for COVID. Shouldn't it be shut down and the staff being told to isolate?
Well, I'm not aware of. I'm not given individual testing results, so I can't comment. Contact tracing, if people have been working together in a close environment, and it's the same people, then 111 would instruct them to isolate, because that would come up via the contact tracing process. You have to remember, though, many restaurants and many takeaways have been working on shift work, so they've been using more than one pool of staff to ensure contingency, that not if one set of staff goes down, they don't all go down, and that's how a lot of businesses have been operating. But it would be pure speculation on my part, because I'm not aware of what takeaway or what the person's referring to.
I took all the information out of that one, obviously, so we didn't name anywhere. How can they get my results wrong? My friend, has been told she was negative in the morning, then received a phone call to say she was positive for COVID.
It may well be the lab has rerun the test. If there is batches where the lab is uncertain, they will actually rerun the test. So it may well be that it's been a rerun test that has then come back positive.
Next one, I think Jason Moore is asking a question about this. If people living on their own could have a bubble buddy, as they do in the UK, that would be that. So 2 single people could buddy up and not mix with others. Government go on about mental health, but I don't think about people being in solitary confinement for many months.
Yeah, I mean, it is a concern. People's mental health, certainly as Minister for Health and Social Care, I've always tended to be very passionate about mental health. People's mental health is a concern, particularly those who are on their own during this period. Bubbles at the moment aren't something that are being considered. If the circuit breaker has to be extended for any substantial period of time, then it's something that may be looked at as one of the options. But we've got to remember the 3-week circuit breaker we're in now, the whole purpose of that was to cut chains of transmission. And the biggest chain of transmission is household mixing. So for the 3 weeks, to eliminate those chains of transmission, the whole purpose was to separate off households so that infections remained within those households. As we move forward, exactly the same as we did last year, we may look to advance measures or change measures slightly or bring in other things. So, for instance, last year, one of the things we did was we allowed a certain number of people in the house from the same household. We allowed people in gardens outside. We didn't refer to them as bubbles, but effectively, let's be honest, that's what they effectively were in many ways. So we may do similar again, but at the moment it's absolutely impossible to say, because we've got to see where we're going, the trajectory, and any decisions are always based on case numbers, because the more household mixing we have, the more people, even with bubble buddies, etc., the more problems you can have. So example of the bubble system, not so much the buddy system, which has been referred to, but the bubble system, one of the big problems the UK found with it was one household bubbling with another, but that meant everyone in those two households had to agree that that was the other household they wanted to bubble with. You may, for instance, have young adults who want to see the boyfriend or girlfriend, but if they're a mixed house, they can't bubble with multiple households. And so that caused problems in the UK. So it's not without its issues, even the bubble system.
I can see the point there. If you've got a single person by themselves and trying to find one other person, that probably is potential anyway, isn't it?
Yeah. Okay. I mean, like I say, it's something that will be looked at if we have to go for a substantial period of extended circuit breaker like we did last year.
Right, I'm conscious of time. I've got two more. Are we okay?
Yeah.
Thanks. Many NHS staff workers have had no one to look after their children because the hub schools and nurseries are closed and have been told to take their annual leave to stay at home to look after their children. Others who have already used up all their annual leave during other lockdown periods have been told they must take time off or work extra unpaid shifts during non-COVID times. How is this fair?
Right, I've had a word with HR about this because I've become aware of some of these issues. There is actually a third option as well, which I would urge people to discuss with their line managers, which is something called carers leave. It is a temporary version of type of leave, but it is available in there if required. So I would urge people to discuss that with their line managers about carers leave. A message should have gone out from the Office of Human Resources actually saying about carers leave to all line managers. So they should be aware of that.
And my sister is 33 years old, no underlying medical condition. She and her husband have just been given the vaccine today. My sister hasn't even worked for 15 years. She's a stay-at-home mum. And to add on to that, I've had another one about a grandfather who left the Isle of Man 10 years ago and has since died anyway, but gets a letter asking to go forward for the jab. You're going to say this is going to happen, I suppose.
There will. I mean, to be frank, no programme, I've got to be perfectly honest, is going to be 100%. We're dealing with trying to administer a vaccine to 85,000 people. The UK system is even more so. I'm aware of someone in the UK who actually isn't even 16 yet who's received a vaccine letter, putting them in the over 50s group. So it's no system is going to be completely and utterly foolproof. There will be the odd mistake here and there. We've seen it where they've been trying to compile the lists manually of the clinically vulnerable, and also the search criteria for the over 70s that had an issue. These mistakes will happen. What matters is that they get spotted and corrected as soon as possible.
Okay, that's our Q&As. As I said, do send them in and we'll be talking next week. And you were saying now that the general briefings to the public are Monday and Thursday as normal. Will that be the case?
We've generally gone for Monday and Thursdays. That may be subject to change as always, but the last couple of weeks we've gone for after the weekend, go for the Monday and then the Thursday. But obviously if we ever have anything that we need to communicate to the public at short notice, then we will do so as we have done in the past, including at weekends.